Hello, hello. I hope you guys are all doing awesome. So, today I'm going to be talking about the thyroid and how it affects fertility, some things for you to know, and how to know if thyroid is playing a factor for you. So, one of the reasons that I really like to talk about this is one of those things that's one of the most hidden topics that when I've spoken with someone and they're like, I've had all the testing done, I've done all the things, I've been trying for a couple of years, I'm not pregnant, or I've had multiple miscarriages. And I ask if they've had their thyroid tested, and they have not. So that's why I'm talking about this. All right. So my name is Heather Rodriguez. I'm a natural fertility specialist. My background is as an herbalist and nutritionist, and I really am passionate about empowering women with tools so they can make a difference in their own fertility, their own hormonal health, and their overall wellness. All right, so let's jump in. So first of all, we're going to start with the basis of what is the thyroid and kind of what it does it do. So we have something called the endocrine system, and the thyroid is one of the glands that makes up this system. And this gland, the endocrine system, is responsible for secreting hormones that will tell the body different things to do. It will tell the body when to ovulate. It will tell the body when to produce different types of hormones. It also will tell you when you get sleepy, when you're hungry, all these different functions. It's one of the main communication centers of the body. So the endocrine system controls metabolism, respiration, reproduction, sensory perception, movement, sexual development, growth, all kinds of things. It is absolutely amazing what the endocrine system does. So the thyroid is one gland out of all of those different glands. And a lot of times we will really focus in on the thyroid because that's something that we can test, that's something we get feedback from. But I do want you to be aware that there's a bigger system around the thyroid, which is the endocrine system. And there's factors in that system that can actually affect how your thyroid is functioning. So this isn't just about how the thyroid functions. The whole endocrine system may also need to be involved and supported. So the thyroid gland is found right here in the throat of both men and women, and it's responsible for metabolism. It's responsible for the way the body uses energy, our body heat, a lot of different functions. And a lot of thyroid disorders can occur because this can be so affected by environmental factors, hormonal factors, and gut health. All right, so here's a couple statistics for you. 1 in 8 women have hypothyroidism, and that's only who has been tested and who has been included in this study. So this is something that I've seen over, I've been doing this 14 years, and thyroid issues and imbalances is something that I've seen increase over the years dramatically. Now, does that mean we're just more aware of it and people are getting testing more, or is this a problem that's growing? So having hypothyroidism or thyroid imbalance can directly affect your fertility. Because it regulates the activities of almost every cell in our body, it is really important to have healthy thyroids. It also will control the body's sensitivity to other hormones like estrogen and cortisol and how we react to those hormones. So hormones are just communication factors. That's basically all they're doing is giving orders to the body. Also, thyroid regulates how quickly we burn calories and how we maintain our metabolism. That might be how most people actually hear about the thyroid. Is some people might have trouble losing weight, so they were like, "Oh, I have a thyroid issue," or that type of thing. And that can play a factor. All right, so here's how you know your thyroid is functioning well. All right, you have energy, you're thinking clearly, you're upbeat. Your weight is easy to manage, not really a concern. If you want to lose weight and you do steps to lose weight, they work. You go to the bathroom you go to the bathroom once a day. You don't have to wear socks to bed or use a liner on your eyebrows because your feet are cold or that you're losing the outer third of your eyebrow. Your hair stays on your head. You're not seeing hair shedding happening. Your skin is moist and your nails are not dried out. You have healthy libido and your memory and recall is very clear. If you're looking for a bit of information, you can pull it out of your brain just like that. So here are some signs that your thyroid might need support. Now, when I go over these, know that this is not don't use this to diagnose yourself. And know that some of these things can mean other things. But what I find is once I see a couple of patterns, or if I see enough of these and someone's uncomfortable enough, just get your thyroid tested. So if you're feeling sluggish and tired and have zero energy, but you're getting plenty of sleep, there's really no reason you should be so tired. You're gaining weight, but you have no idea why. It's not like you're eating more food and you're being real, with yourself. You're not eating more food, you're exercising, but you continue to gain. You have trouble losing weight. If you experience insomnia, trouble falling asleep, or waking up in the middle of the night, now this is also a cortisol factor. So don't let that be like, if that's the only thing on the list, don't let that be your thing, because that could be a couple of things. So the main one that I do see is brain fog, memory problems, and trouble concentrating. So I do have hypothyroidism myself. I have subclinical, so the numbers aren't like dramatic. But what I find is when my thyroid is needing more support, I just cannot pull a thought. I can't remember common everyday things that I think about all the time. And then once I'm back on it and I'm supporting my thyroid, my energy and my mind is just completely back to normal. So for me, that's a major factor that I can see. Feeling sad or depressed without being able to pinpoint why, that also can be nutritional deficiencies, dehydration, a lot of different things. But if that's compounded with some of these other things on the list, feeling anxious or worried, but there's no specific reason, sluggish bowels or constipation, feeling cold or chilly, even when everyone else is warm. This was another major one for me. A major one I see with a lot of my clients is they are the person who has to wear socks to bed, or they're just cold no matter what. It's not even winter and they're still cold. If you have really dry, itchy, or rough skin, or your hair is coarse, your nails are brittle, that kind of thing, your hair is falling out or thinning, or again, you're losing like the outer third. So those are all very specific signs to the thyroid. Another is high cholesterol. That means multiple things. Puffy face and around your eyes. I never personally experienced that. And then all of this coupled with some fertility issues. So if your cycle is off, you're not ovulating, those types of things. And also postpartum depression and trouble producing breast milk. Again, those can mean other things, but thyroid, especially around fertility and pregnancy and postpartum, is huge. A lot of women sometimes like they will not even have a thyroid issue. And then after giving birth, they all of a sudden have hypothyroidism because of the taxing, what pregnancy can do to the body and how taxing it can be. So some factors to consider. Now, something I think is really important is if you have been trying to get pregnant for a while, 6 months to a year or more, and everything's like your cycle's just right, you're ovulating, you're tracking your cycle, you know all of these things, and you haven't had your thyroid tested, definitely get your thyroid tested. Now, something that's really important when you go to get your thyroid tested is every doctor is going to have different information on what the baseline needs to be depending on when they last did research. So thyroid research is an area that's constantly changing because of new information coming in. And what I tend to follow is what reproductive endocrinologists are looking at. One, they specialize in the endocrine system, and two, they're specializing in reproductive endocrinology. So the numbers that they use to monitor you is what I go by. So that's who I would personally go and get testing done, or a doctor that I'm working with, but I would ask, what are your levels that you go by? So generally, they're wanting them to be between 0.3 and 1. Depending on who you talk with, it's going to range. I've spoken with doctors who find that 8 is a perfectly fine number, and 8 is not a perfectly fine number. So it just depends on when they last did their research and kind of what their beliefs are around the thyroid. So with reproductive health, it really does need to be pretty dialed in there and managed. So thyroid imbalances can lead to a lot of different menstrual disorders or like disruptions when it comes to fertility. One of them is your cycle can just kind of be out of balance. Your estrogen and progesterone, like the body might not be responding to them. Your cycle length can be affected. But hypothyroidism is something that I believe is becoming so common, especially subclinical, like the numbers being like 3, 2, not like these really, really high numbers. So a lot of it just kind of gets pushed to the side. Or your numbers are fine, but your T4 and your T3, they're other factors in thyroid hormone production could be off. So T3 has to convert, or T4 has to convert to T3 in the gut in order to make thyroid hormone. These are precursors. And so if you have gut issues, this can be a factor. So you want to get 4 things tested: TSH, T3, T4, and antibodies. Antibodies are going to be something that's Hashimoto's, which is autoimmune. It's a little bit different than just regular hypothyroidism, but it is actually the most common type. There was a study that was done that women, 76% of women who had hypothyroidism were able to conceive after being treated for their thyroid condition. So that's pretty serious statistic. That's how much it can affect your fertility. Also, women with endometriosis were 9 times more likely to be diagnosed with hypothyroidism. Just a couple things for you to know. All right, so when you're getting testing done, make sure to ask for a full panel testing. If your doctor is kind of brushing you off and refusing that or whatever it is, find another doctor. I speak with way too many women who go in early pregnancy and ask for progesterone testing, and their doctor says they don't believe in progesterone testing. Find another doctor. If your doctor kind of, you ask about thyroid or these different things, find someone who will help you, because there are so many amazing doctors that understand thyroid, that are on top of this because they're passionate about it. And the easiest place to go would probably be a reproductive endocrinologist. Most of them, they will be the ones doing IUI, IVF. You don't have to go forward with any of those procedures. You can just go see them for testing and for consulting and decide where you want to go from there. And so one last part is like, why are we experiencing so many of these issues, right? So why is the thyroid such a factor? The thyroid is very sensitive to environmental factors, heavy metals, stress, and also nutritional deficiencies and depletion. There are some genetic factors, but those ones we don't really have any control over. So I don't really cover those much, but if you have a genetic factor, you will know, because there will have been other way bigger signs, or through testing, they will end up discovering that, but that's way more on the rare side. So because of our constant exposure to heavy metals, endocrine disruptors, those types of things, and nutritional deficiencies, we're seeing an uprise on this. Now, the good news is that there are definitely things you can do to help support the thyroid. There's different nutrients, there's different supplements, and there's also obviously medications you can work with your doctor, like Thyroid, or whatever it is that they might be having you on to find your right levels. So know that you have a lot of options. This is an area that you can definitely make a difference in. And I find it's just really important to address this. Some women will just come to me and say they don't want to do supplementation or medications for this. They want to just treat it with food. Now, I am a nutritionist. I'm passionate about food. You guys know this. I'm constantly talking about nutrition. This is one area that I don't just focus with nutrition. I definitely include nutrition, but it's not the only place that I focus on, because once you are pregnant, you have to continuously have, and like if this is a known issue for you, right? You need to continuously have your thyroid monitored and checked and be working with your doctor so that your levels stay healthy. Once they get to a certain point, you do have an increased risk of miscarriage if your thyroid is not being managed, especially with Hashimoto's hypothyroid. So the chances definitely go up with that. Now, this is something that can be managed if you're being monitored. So I definitely believe in that. This is an area that's really great to have a holistic approach, including your practitioner or doctor, or if you have enough time ahead of time, really managing it naturally, continuously getting your levels checked to see where you're at, not just like doing all the things and just assuming that you're absorbing everything right and so on. Because a lot of people will do the steps, but then their gut health could be a factor that they're not focusing on, or they could have over their lifetime have exposure to heavy metals that are actually affecting the pituitary, and it's a little bit higher up in the endocrine system where these imbalances and issues are happening. So, so that is the thyroid and how it can affect fertility. Now, I have a whole entire class that I did that really goes into this. It goes into the endocrine system, and then it also goes into like, what can you do? What is it? What are the steps to take? What are the supplements to take? How do you support your whole endocrine system doing an endocrine reset? How do you support your thyroid? Those types of things. So what I'm going to do is I'm going to put a link below so that you can go ahead and sign up for that replay. It's a replay class. And what'll happen is you sign up, so put your email address in. I'll send you a link to the class, and you'll have some emails where I start going into this in bite-sized pieces so you can learn more about thyroid and what natural therapies you can do to help support yourself, in addition to having testing done and those types of things. So I hope you found today's topic helpful and this class helpful. Now, a couple of things before I jump off. First is I'm going to be teaching a natural fertility charting 101 class next week on Tuesday. One of the ways that you can tell as a first step where your thyroid is by charting your temperature. That's one of my favorite things about fertility charting, is you can tell on a chart possibly where your thyroid's at based on your temperature. So that's one of the things I'm going to be teaching in that class, as well as many, many things on how to chart and how to tell kind of what's going on with your system. So that link is in the bio in Instagram, and on the Facebook and YouTube video of this, I'm putting a link to my courses and classes where you can check that out. If you have any questions or you want to do more research on natural fertility, visit my website, naturalfertilityinfo.com. You can also check out my shop, naturalfertilityshop.com, where we have natural supplements and support for fertility. But I hope you guys have a fantastic day. I'll see you again tomorrow at 10 o'clock Mountain Standard Time.